So wait, how do you know? But yeah, because that's what I wanted to know, because you do a lot of different things similar to me.
Yes.
How do you
maybe
know?
not similar
Well,
to
no, I
you.
mean, you have a lot of variety of things that interest you.
Yeah, variety of things that interest me. I would just say, let's not put us at the same level there.
That's okay.
The reason why I know so much about skin and also just health and wellness was, one, I got diagnosed with melasma when nobody really knew how to treat it.
And you're light skin tone.
And I'm
Most
light
people
skin
wouldn't have
tone,
thought you had
and
it.
it was mortifying and embarrassing. And so I really had to learn. So I'm on Real Self, looking up to see what you say, like weird chat rooms, trying to
When
read
was this?
medical journals, like the early 2000s.
Okay, because now there's a lot of treatments for that. So people that don't know what melasma is, it's hormonal pigmentation, basically. Yeah, they call it pregnancy mass because women get it when they have hormone changes.
Yeah.
But you can have it without being pregnant.
And I have Hashimoto's.
Oh, so that also can put you at risk.
Yes.
So Hashimoto's is a thyroid disease, you guys, that also can cause you sun sensitivity.
Right.
So that's really the issue. All autoimmune diseases, hormone changes, heat. Like I have women where they go to hot yoga, their melasma will be perfect for a year. We've done everything, peels, skincare. I actually developed my skincare line to treat pigmentation for sensitive skin tones, which I want you to try because I know you like skincare.
Yeah.
And then you'll have somebody go to hot yoga and it'll flare back up.
So did Cosmelan, and then went to a RIP, went to one of those like urban sweat lodges.
Oh no.
And just ruined my.
And that's the thing. So a lot of people don't realize the impact that internal has on your skin. And that's what I talk about a lot. So originally when I started at that time, there wasn't any focus on what goes on inside your body. The only treatment we had actually that did something internal besides for actual medical diseases of the skin was Accutane. And that was able to internally get rid of oil glands. That's basically what it does. Doesn't do hormones, doesn't anything like that. But there was 0 treatments that existed. And now there's still 0 treatments that exist, but people utilize other alternative medicines to decrease inflammation, protect you in the sun.
For me, it's been
and regulate hormones. So that's what I was going to ask you.
Okay.
Where's the inflammation coming from?
Oh, probably my thyroid.
Okay.
But when I noticed, I did like a liver cleanse once and my melasma cleared.
Yeah.
And then it kind of stands to reason, feel free to correct me if I'm wrong, but estrogen gets like processed, I think, through or with the liver
and kidney.
So when I alleviate my liver, I notice that my melasma is better.
That's
and I have
really
tried
good.
to say this to certain dermatologists, and they have been like,
Well, that's the problem. A lot of them don't believe in
Right.
these alternative things, or they don't understand the connection between internal and diseases in your skin.
yes. And that is a through line, I think. That has been a through line in my life, which is what's so exciting about what you do, because I feel like you are very internal and external,
Yes.
which is really exciting. I can't wait to talk about peptides.
Oh,
but
I'm so excited. I'll talk about them right now a little bit, because actually, interestingly,
they can help with melasma?
yes, and that's the thing. And we were talking about liver. So I'm curious, why did you do this liver cleanse? Like, what did you do? Like, what was the liver cleanse for you?
I had a record deal at the time, and I think
Okay.
they just wanted me to lose weight.
Okay,
So
that,
I
it
think
would help.
that's what it
It
was.
would help.
And I mean, yeah, I guess it kind of made a little dent, but really I noticed, whoa, that's weird. My skin's clearing up, and it just always stuck in my mind. And then I let it go. And then when things got bad again, I had that in the back of my mind. And as I would just be like piecing together little bits of information, I'm like, okay, this is definitely a thing for me.
Yeah. And I feel like for a lot of people, so if you look at things like carnivore diet or like unique diets that have no, let's say, processed foods, people's skin significantly better. There's actually this girl online, I got to get her for our sticks of butter every day.
Oh, wow.
And she shows pictures of her face from a year ago having acne and melasma, and now it being totally clear.
That's crazy.
Now, obviously, I wouldn't go tell you guys all eat a stick of butter every day, although if you do follow a carnivore diet, technically, since it's unprocessed and it's just fat, you could eat that and still be healthy based on this diet. But the idea is that you just eat things from the ground.
Yeah,
you don't,
that makes sense, yeah.
So internally, when you process those, much less inflammation. You have better gut health, you have better processing through the liver and the kidney. And because of that, all your metabolic processes in your body are just better. You don't have as much oil, you don't have as much sensitivity, inflammation. What were you going to say?
About like amino acid tablets. How do you feel about that?
So the thing is, no, they're really good.
Okay, good. Okay.
They're really good, but they don't get it fully absorbed.
Okay.
So you have to take higher than they actually tell you. So that's
So
why
not
like guys, well, like guys that want to build muscle, for example, they'll take what are called branch chain amino acids.
Yes.
Those tend to be the ones that are best for your muscle.
Okay.
So when you take them, you have to take a lot of them and drink them kind of quickly so your body absorbs them.
Okay.
If you're talking about amino acids, things that affect like collagen production and skin, they are usually ones that don't need to be absorbed as quickly because your body's those processes are occurring all the time. Actually, in fact, it's probably better to take them at night because when you're asleep, your processes slow down to recover, and that's when collagen's produced.
Okay.
So that's the thing is like it's everything is theory.
Yeah.
In a book by biochemistry, and then you have to figure it out. Yeah, exactly. So over the years, I figured that stuff out. But I'll give you an example of internal things affecting the skin.
Yeah.
When I was initially in practice, I had this one dermatologist, and she always told me I was wrong. It did not matter what I suggested.
Fun.
Oh, she was really fun, believe me. She was really fun in my residency when I literally would go against her and then get in trouble all the time because I had patients where I saw that if I put them on Accutane for severe acne, they would be so happy when the acne cleared, but it was always this book of 20 weeks was this in the textbook. And so at 20 weeks, she makes you stop because that's what the textbook said and it's what she did in the 80s when it was studied. And I was like, well, some of these people are so bad that a month or two later it starts to come back. So the studies now show 15 years later that if somebody has it very severe between ages, let's say 14, sometimes even down a little bit younger, even 12 to 21, the chance of it recurring within 5 years is very high. It's significant. It's like 30 to 50%. It's high. So the studies show do it double the length of time and do it even like a lower dose for a longer period of time. I did that 2007. So almost 20 years ago, but I got yelled at by her. And so there's all these people that had to be in a textbook or it had to be, you know, by a very specific way and weren't willing to go sort of outside the box and figure it out. And that's what happens in clinical practice when you're good, when you actually have patients that are willing to kind of test a little bit. And what I have are patients that want to go to somebody that's trying something different. And so like I'll have like even myself, I'll tell you, I'm one of the dermatologists, never prescribes tretinoin. I'll tell you why.
Really?
Oh yeah, you're gonna go crazy. And I know, especially for a skincare guru right here.
Oh my gosh.
And I also don't prescribe antibiotics for acne.
Okay,
So I mean, it can help in a flare. Like I have a friend right now that we just saw after Soul Cycle has these like cysts that he never gets acne, and these cysts flared up on his face. And I went to my office when I wasn't there, and they're like, "Oh, he came and he has acne." I'm like, "That's not acne, actually. That's staph bacteria that people just can get in the community. There's always flares of this every couple of years, and especially in California, there's this whole like community acquired MRSA, basically this type of staph that's just not resistant to antibiotics. And the reason they're resistant is because everyone here gets antibiotics all the time. So if you're on the East Coast, doxycycline, for example, works great to treat that. But if you're on the West Coast, because so much has been prescribed, if you actually test the bacteria, they can't take doxycycline. It doesn't work.
Such a hot tip.
I know.
That's a crazy
So
tip.
it's crazy. You need to know this because, and I know this is not even really about grinding and being part of a hustler or something, but it's the importance is even as a cosmetic doctor, I'm still researching this stuff and reading about it all the time. And that's the one thing I tell people. I had a new doctor that came to work for me, and I asked him one of the first weekends he was here, what did you study over the weekend and everything? He's like, oh no, I went out and had fun. I'm like, you literally just started and have no patience and you're just going out and partying. Like,
that's crazy.
You should be like, I'm doing that every day. And I pulled out a stack of like magazines and stuff and like in my field. And I was like, I'm reading these right now while I'm working every day.
I'm reading
and literally,
these and I don't even, this is,
I know, that's, I mean, you probably know more than him actually. So it didn't work out with him in our practice. But basically what I mean is here, you have to use Bactrim, which is a sulfur antibiotic. And the issue with that is 30% of people get a drug rash. They'll get a rash and some can be very severe.
So
where
interesting.
all your skin can peel off.
To treat rashes?
It is actually, but it can cause one, and it can cause a very severe one called Stevens-Johnson syndrome. That when you've actually seen it in real life, and you should Google it or use chat because it'll show you. It can even cause it causes your skin to peel off, and people can die from it. And and actually some people where you actually have skin on your eye. Your eye itself is a layer, and so that layer can peel off, and you can actually get blindness from it. It's really sad. So I remember one of the first times I was ever on call. I actually had my family come and visit me in New York, and we were going to go see a movie because I'm like big on movies. And we're going there, and I have my pager because this is at the time we'd have iPhones, and I'm like, get the beeps, these beeps. I'm like, no, like right when we're gonna walk in, and they're like, we need you to come to the emergency room. We think this person has Stephen Johnson syndrome. And it was like the first or second week I was a resident, and I didn't know anything about it.
Yeah.
I know. Well, that also I wanted to see this movie, but I go there, and it was like life changing what I saw, because then I realized, and all these people that watch Grey's Anatomy, and they see you go into the dermatology, and it's like beautiful, and it's all cosmetic. Like my practice is now. But when I walked into the emergency room then, and you touch someone's skin and literally it peels right off and they're bleeding and basically could die, you realize that like dermatology can actually be something that's truly serious. And I did mine in New York, where I saw tons of diseases, where I saw, I'll tell you another amazing story about rashes, but various things that if we hadn't stepped in, people could have died.
So is Clinical the brand?
Yes.
The founders...
We sell them.
Of course you do, yeah. The founders started with their hero product because the leading cause of like teen child death at the time was suicide because of acne.
Yeah, I know.
So
and
like,
that's why I think it's funny.
Dermatology is important. To say that this is vain and vanity, like, okay, but...
So this is what I was talking to my client yesterday about. People's looks matter, whether they're famous and on TV and it's their face that people are seeing, or it's just how you feel. Because if you look at yourself, and it could be the smallest thing, and it bothers you, it could affect your relationships, it could affect how you your work-life balance, it could affect basically everything. And that's why I am very lucky, because one of the things I did at that time when that dermatologist was yelling at me and I started people on this Accutane, we would clear them and then they would have scars. But luckily, we could stop the scars a little bit earlier. So I was one of the derms, and I'm actually the highest prescribing we call it's isotretinoin. Even though Accutane's not even really exist anymore, but that was the trade name. I'm the highest prescribing of that on the West Coast, and I'm a cosmetic dermatologist. I even put people, famous athletes, that are on 10 or 20 milligrams a couple times a week forever. Just so that they don't have oil, like your skin. And there's these TikTokers now are talking about nasal slimming and like smoothing your skin with Accutane. I'm like, we've been doing that for like 15 years, but it's like something that they're learning now.
Right. Yes, of course.
And they're making it out to be like it's brand new, but it's not. I've been doing it for a long time.
You're like, if this is brand new, then I haven't had a job for the last 15 years.
So what's cool about it is, the reason I brought that up was I would put people on this isotretinoin and they would clear, but then they have scars. And so that's how I got into doing more aggressive treatments earlier in a person's life, or in the stages of being a dermatologist that kind of does one thing at a time to see if it improves. I was like, I'm not going to do one thing at a time when someone's self-esteem
is on the line,
is being affected. And if you take like even a 14 to 16-year-old girl who, I mean, boys can get away with it a little bit more, I think, at the beginning, but girls, it's very difficult with them. For them as they, go into high school and college, and how they feel about themselves. And if you don't treat those scars early enough, it affects them, I think, long term.
As someone that was once a 14 to 16-year-old girl, I can confirm that. Yes,
and that's the thing. And I think it can potentially change you. It'll also potentially restrict. I mean, no one should judge another person based on their looks, but at a young age, everyone does. Exactly. And so you don't want someone to not have a relationship that they could have been in, or not do something because they were depressed. Maybe this person could have been an athlete or a musician or something, but they were depressed, so they didn't pursue it.
Yes. You also said something that's very interesting, and you were talking about how you're constantly researching and pushing the envelope, and also that this might not have to do with hustle grind, but I will say my life ground to a halt in 2018 when I got really, really, really sick. And I went to 14 different doctors.
Oh, wow.
Sorry, I have hair. Wow, that was crazy. Okay. I went to 14 different doctors in LA who all told me I was the picture of perfect health. It got so bad to the point where my neuroinflammation was so bad, I would look at photos of my friends and I wouldn't be able to say their name.
Wow.
I'd walk into rooms, I wouldn't know why I was there. I wasn't able to write. It was really, really, really traumatic, and I was dying. I mean, I was literally losing my life.
Wow.
And
how did this start?
It's a great question. I have my theories. I was diagnosed with Lyme disease, misdiagnosed, fine. The place that misdiagnosed me put me on low-dose naltrexone, which ultimately brought my quality of life back to normal. Then it would take a few more years to get to 100%. That's when I tried peptides.
Which peptides?
BPC 157 and thymosin beta 4.
Okay. I have two favorites. Now we're going to go into very deep detail.
Yeah.
I IV myself with them.
I know, and I have so many questions about this, but just
to just
circle back, I just want to say it's doctors like you that helped me. So it is really about like the hustle. Like I had a 6% chance of recovering.
Did you ever find out what it was?
Chronic fatigue.
Okay.
From a virus.
Yeah, that happens so often.
So basically, I had long haul COVID before
it existed.
COVID existed.
Yeah, well, that because viruses do that all the time.
100%. We now know this, and I didn't. And when I tell you, I was like so in the dark. I mean, I really lost my life.
Yeah.
And
especially if you can't function because of pain or focus or just your mental state.
100%.
It has a huge effect.
Sleeping like 14 hours a day.
Oh,
I mean,
wow.
it was really, really bad.
I can see why they probably thought that was Lyme disease.
Yes.
But the problem is too many people are misdiagnosed with Lyme disease all the time.
Yes. And I mean, all the labs, all the blood tests, whatever, the lab tests for Lyme are, at least
a
when
lot
I
of
was
them are
doing
not
it,
perfect.
They're not great. Yeah. But to full circle it, like we're talking about some of these treatments, and we're also talking about doctors that have a similar outlook as you, and how without people like that, I would not be here.
Wow.
I don't. Yeah.
So did a doctor suggest it, or you did research and then said, I'm going to try these alternative therapies?
Combos of both. And
what type of doctor told you to do that?
The peptides did come from a doctor.
Yeah, but like what type of doctor was that? Just curious.
It's
because it's rare for a dermatologist.
It's not a dermatologist. So it wasn't a dermatologist.
Was it like an internist? Were they like regular medicine, or were they alternative?
Yeah, it was an alternative internist.
So that's actually good.
He was board certified.
No, I'm not saying that. I'm just saying a lot of times the people that are actually looking into these things are usually more athletic or maybe internists that pushes the limits a little bit. Yeah, I really I don't see like these cardiologists, like people that are like really medical textbook, like they all don't think that what I do is right, all the time they tell me.
Yeah, well,
because they're not FDA regulated things. You can I guess partially order them online from unknown sources. I don't think you should ever do that. I think you should go through a compounding pharmacy or a research lab.
Yeah.
But you also, I believe, have the right to take anything that you want for yourself.
I fully.
And so I just tell everybody, look, this is research purposes. I ran clinical trials when I was younger, and I have great stories about it in the medicines that truly helped remarkably change people's lives. Mm-hmm. And I think that's how I got into being willing to be a little innovative and push the limit. And that, I think, led into me being more of an entrepreneur and being really successful, because I was never satisfied if someone came to me and I didn't have a solution.
Right.
And I think that's the whole point of sort of this podcast. Mm-hmm. It was not about as much entrepreneurial success in financial. It was more about what makes somebody feel like they're successful. And sometimes that is happiness. Sometimes that is having family. There's all different things. With me, it was being the best at what I did. Yeah. And I was never okay if a person came to me and gone to 3 doctors and I was not able to help them.
Totally.
So I had to figure it out.
The solution was out there.
Yeah, most likely. Or you have to try something you never would have thought of.
Yeah.
And that's where I think peptides came in. Because originally for me, I was very big into health and fitness. Mm-hmm. I wanted to get even, healthier when I basically was about to hit 40. Mm-hmm. So I'm in my 40s. And I was like, okay, I need to look and feel my best. So what can I do? I got to diet and exercise, or though not diet, just eat healthy, exercise regularly. But what other things can I take that are make me live longer and feel better and optimize like my muscle growth and stuff? And then I started kind of learning a lot more. Mm-hmm. I had 2 physicians actually that worked for me that did these alternative, mainly for gut health. They were doing like stool samples and saliva and doing things for like DNA, and
which are now way more mainstream.
Everyone's doing it now. You can actually go online and have it sent to your house and sent back to companies, and they'll just do it.
Look, I've done all the things, because when you feel the life draining out of you,
which you had.
I had no choice. It was to advocate for myself and find the people who could help me or find the things that could help me, or I was going to have to say goodbye to the life that I had.
Yeah, that's unbelievable. What did you, because there's like these stem cell companies that come and try and like do stem cell therapies.
Totally. That was on the menu. It didn't get there because
okay, good. It's very expensive too.
And
not always
and risky
helpful.
too.
Yeah,
like if you really have to, I think, do the research on that before you let anybody inject your spine or knee
or fat.
Or
they take your fat and put it into your veins and stuff.
Yes.
It's crazy.
Think,
well,
the pros and cons of that.
So let's talk about BPC and TB4 or TB500.
And that was to heal. So for autoimmunity, I feel like there's the 3-stool approach where it's like trigger, genetics, and gut health. So one thing you can control is your gut health. And because I couldn't control I didn't know what the trigger was, and I can't control my genetics yet.
You will be able to at some point. Brian Johnson claims you can soon, very soon.
On that.
So you did gut health.
Yeah.
What did you do?
BPC and the thymosin.
So that's actually why I just created my new supplement, which is Vitasculpt. It's BPC in an oral pill, but it also has in it 2 other ingredients in it.
I don't
know if you've seen it. So one's called phosphatidylethanolamine, which is a fatty acid that's mainly it's a neural fatty acid. So it goes to the brain.
For me at the time.
I know. Actually, it would have been really good. It's very good for mental focus, Alzheimer's prevention, most likely.
Amazing.
And anyone that has anything like a post-encephalopathy, or like you had potentially a viral issue that causes inflammation, maybe making you tired, or even affecting nerves, like things that cause sensory changes from the brain. That's what it's really useful for. And it can also increase a little bit of focus. So we do other things that increase circulation, but then you want to supply the neurons with the proper outlining sheath linings, which is your fatty acids basically. And then there's another one called AOD, which is used mainly for reduction in fat, but it helps you, like if you're trying to lose weight, you'll lose more weight. If you're not trying to lose weight, it'll keep you at a stable weight and make it so that you metabolize the fat cells better. So that it decreases your blood sugars and stuff.
Okay, that's what I was
And it can actually partially increase growth hormone. So for women, I think it's really good actually as you get above 30, because those levels will start to drop. And then that AOD will help you if you don't want to take another peptide like a CJC or tesamorelin or any of the ones that are the growth hormone releasing peptides. It's really useful. So we tested it for over a year, and now I have clients and they all love it.
Why
so far.
oral and not needle?
We could do it in a needle. I just wanted it to be available to everybody easily.
That's cool.
So you can buy it online. So that's what we do.
Amazing.
But that's what I think would be so useful for someone like you who had a chronic fatigue-like situation in the past, that you need to have optimum energy all the time, optimum decrease in inflammation. And the BPC is, I think, very valuable for gut. I take both injection and the pill and do IV. Actually.
Yeah, I've never heard of
I know.
peptide IVs. Is this new?
I think
or am I in the dark? Okay.
No, I think it's new. I think it's that people are nervous about doing things that have never been really tested. Yeah. And so we have patients that they undergo very large laser treatments or big surgeries. But I have some clients where they're like major celebrities and stuff, and they need to be healed really quickly. Or like let's say I have a news reporter, one of my clients on the East Coast that like will do anything, but in 3 or 4 days needs to be back, right. Yeah. So maybe with makeup there's a little bit, but so what do we do to speed it up, right? In the past, so that's what I was gonna say. In the past, we didn't have anything. Yeah. Then it became things like oxygen facials and stem cells on the skin. We infused them, and then it became adding hyperbaric therapies, which we have in my office, and then red light. It's okay. Doesn't matter.
Okay, great.
This is pretty good. Yeah. Then it was red light. You can do it at home and in the office if you want. Then it was adding things like peptides to decrease inflammation, or even
taking notes. I'm like, okay,
beforehand, it was things. Even, that's fine. We'll make a whole package in the office, was then CBD. That actually is very popular. I do medical grade CBD in our office. So all my patients that do lasers and surgery and have any chronic pain, CBD pills. I take the pills. You can do drops if people like drops. Yeah. I think for like exercise, or let's say, it's raining and someone's knee hurts, whatever happens. Sometimes the drops are really effective because they're fast and more of acute. Right. And then it got into things like arnica and things that would like internally help decrease inflammation. And then it was these IVs. And so originally it was NAD became very popular.
Yeah.
I think
I actually don't know a ton about NAD.
I'll tell you all about it because
I feel like you could.
I feel like there's a lot of reality TV that talked about it, especially on the Kardashians and stuff,
Right.
because they constantly are doing it like every week or every week, 2 weeks. A lot of people that do like run marathons or big into exercise and fitness, they were using it for recovery.
Right.
Your body, it's basically a
for
cofactor.
mitochondrial, right?
Yeah, it's a cofactor for enzymatic processes in your mitochondrial cells. We know that mitochondrial cells produce DNA and they have and produce energy, and so you need them to be the most optimum,
top,
right?
yeah.
If you want your metabolism to be the best, right? You have people that say, "Oh, I work out all the time, and I get no results." Well, that's probably because at the base of it, their mitochondrial cells are just not functioning well. So what do you need to do? You need to, some people go, well, I'm going to give something that boosts their metabolism. Well, boosting metabolism might be heart rate. That's dangerous. You know, that's ADHD, that's like Adderall medicines and cocaine and stuff like that. Not something I think people want to take regularly because it won't be good for you.
I mean, some people really do.
They
want to take
do.
that
I think they do, but as I know, but in the medical community, I don't think we're going to be prescribing that easily.
No.
So I would say people want to do stuff that's also going to help them and make them live longer. And that's when things like NAD came out and became more mainstream, even though it was out for a while and only like athletes and professionals were using it. Now, then you have like a Next Health,
like everything.
Yeah, then exactly. Then you have like a Next Health, which kind of put it out there into the community in IVs. But the thing is, they're doing like even pretty low doses.
Okay.
If you go to like a medical, like what we do in our office, we're doing 2-3 times the amount to help someone heal.
Sick?
It can, but you could do things where you do a slow drip, or we give these patches that regulate your brain to tell your body not to feel nauseous. So you put these patches on a day or two before, and then you can go get like, oh yeah, that's exactly what they're made for, a scopolamine patch. They were made for people on the boat, basically sailors and stuff that would get nauseous. And if you go on like travel, if you're going on a plane flight, you just, you know, get nauseous on them. So you could do that, let's say a couple of days before, and keep it on there, and then you go and you can get this high dose and feel fine. There's also some pills you could take at the same time, but the point was they would do these high doses and everyone would feel so much better. They have a lot more energy. They would sleep better. When they would work out, their recovery would be a lot, you know, easier for them, less joint pain, less muscle pain. And then all these anti-aging doctors came out and said, well, people that have been on this for a long time now live longer. So less heart attacks and strokes, and overall better joints as you age and things like that. So everyone's like, I need to do that,
and
right?
now there's like this huge push for like mitochondrial everything.
Yeah, so that's why orally there's True Niagen. I don't know if you know that company.
I take urolithin A.
Okay, that's good. That's nice.
I try to I cycle through things instead of trying to take like 50 things at a time.
Yeah, like there's precursors too, and then there's like the True NAD, but the studies show actually that the injections, so that's a precursor. So when you take it, your body produces it, and then you function better. I take that too. People don't think it's as good, but True Niagen is very similar to that. It's a company that makes some of the precursors and NAD, and then NAD itself, the injection is actually better for you. The dosing is higher and it stays higher longer.
Okay.
So if it was me, I would tell you take the oral pills every day, whether it's a precursor or, you know, that whichever you choose, because no one really knows. And then the injection at least Monday through Friday or 3 to 5 days a week minimum. I do much higher doses, like 50 milligrams a day.
So you've worked up to that.
Yeah, but you could probably do it if you really wanted to. But most people start like 10 or 20 per day, like 50 to 100 a week or something like that, up to, let's say, 300 to 500. Because on average, people do 500 to 1,000 milligrams a month. But if you do like my protocol for people, it's like 2 to 3,000 something. So it's higher.
Okay, cool.
There's never been anything showing that's going to harm you. But the energy levels you will have,
are great.
Sleep, it might be good for hair. I think it's good for women as they get a little bit older and their hair thins. I think it's good, but so is BPC. So this is how it led into that. So I was doing this with my patients after surgery because you're getting all these drugs. You're getting, when I do liposuction, medicines in there, and then you're getting general anesthesia. So your body needs to detoxify these. So how do you do that? NAD IVs, People do it for alcoholism. They do it for detox, Lyme disease, energy. So I was like, we need to do this for surgery. So this is many years ago, before anyone was doing it. And I actually worked in a clinic that treated chronic Lyme. So that's how I started doing that.
Oh, wow.
And so then I said, you know what? Let's just put stuff in there. Let's do vitamin C. That's where we started first. So then people's skin got brighter. They felt a lot more energized because you use vitamin C as a cofactor for NAD. So then how about glutathione? So we added that. That's good for your liver. It's anti-inflammatory.
That fucked me up once.
What did with the IV?
When I was sick.
Oh, well, what happened?
I think there was a push. And
it's too
because
much, a lot.
You
have to, so we do it in the IV slow,
Yeah.
but you can do a push at a lower dose. They
Yeah.
probably gave you too much. What happened?
Glutathione. Ooh, I had I was like, am I high? Like, I was like, what
it can
is
do that.
happening? And then I looked in the mirror and I looked like
Swollen?
and dark. Like, I was like, oh yeah.
It should brighten you,
I'm
but not when you
dying.
do a high dose.
Tight.
Well, it's like, luckily you didn't. That's good. No, it won't kill you. It's good for you. Actually, in India, they do IVs almost every week to brighten their skin tone with glutathione, but high doses.
I take it, but I guess that might not be.
No, glutathione orally is good. There's actually the gels
That's what
are
I take.
better than a pill.
Yeah.
So then I was like, you know what? Why don't we try putting the peptides in there? Because if we do it the day before and a couple of days after surgery, and there's these high doses in someone's body, many of them have shown to have no side effects at all.
That's amazing.
So I was like, and then nothing happened. Nothing happened negatively.
Yeah.
But I had a 72-year-old patient who chronically had terrible arthritis, and I was like, let's do 3 days in a row, and I put her on that combo, and here she is doing her soul cycle right away, 3 days. She's like, I've done every single thing, and the only thing that helped me was that IV. So then when we started, this is, long years ago, now we're doing more people that wanted, like after surgery, you don't want to get an infection. Yeah. So we started TB4 beforehand. It'll be injections they take for a few weeks, but I was like, why don't we just throw that in the IV? Yeah. And then never had an infection after surgery.
That's
never.
amazing.
So I think it really boosts your immune system. I've been taking it for 3 years. I think I got sick one time. How many times have I been sick, Nicole? Once?
I don't remember.
See, she can't even remember. Doesn't even know.
That's incredible.
So,
Only once, maybe when you've been in New York because I was really swollen there.
yeah, I got one time. That's right. When I came back from New York, but I had worked for like 10 days straight, I think. So, and it was cold. So that's possible. But I've never been sick really. So I tell people, even patients with HIV, those even transplant. I have a patient right now who's undergoing radiation, and what is the other thing that she's doing? It's not a chemo, but it's a different
Something
treatment that's like a
that.
chemo.
Yeah,
I forgot what it's called.
yeah.
And I said, I want to do IVs of this. And the doctors don't want to, of course. But I'm telling you, it boosts the good cells in your bone marrow. And
and for people that aren't like that, I would assume that if people follow you, they probably already know, but maybe not. But like your body makes these naturally.
Yeah, I mean, that's the thing. And it should stimulate your body to produce more of the good ones.
Right.
And that's the thing, is if they do, then you could maybe fight a cancer or fight an infection before it occurred, or protect you. Just be your soldiers to protect you from being sick,
Exactly.
So that's why
and make
we
you prettier.
suggest it. Exactly. Well, so then I always tell people the beauty peptides, first off, if you are healthy, your mitochondrial cell metabolism is good, you're going to look and feel better, you're going to be more hydrated, hair is going to be better, hair, skin, nails, eyes, everything. But there are peptides that are really for beauty, like help collagen production, help brighten the skin. Yeah, exactly. So we do GHK, which is a copper peptide.
Which is what I'm doing now.
Injection?
Yes.
Yeah, it's the only one I hate because it hurts.
I know.
But
it looks like, I feel like I'm in The Substance, the movie, every time I do it.
Yeah, because it's colored.
Blue.
Is it
I
blue?
guess they're all blue. Yeah.
That's fun.
And mine has
although you
BPC
don't want to
in it.
turn into,
I know.
the good side, not the bad side.
The good side. But it feels a little bit like that. But because I now am in a good
It's great. So all
place.
my melasma patients,
Oh.
I have them on it. That's what I put GHK for, so you should prevent. The other thing I tell people to do, this is not a peptide, but it's a medication, is tranexamic acid. So oral TXA.
Yes, I've done that.
So I have people do that,
incredible.
and it's anti-inflammatory too. It's just, you're supposedly not supposed to be on it when you're pregnant, but I haven't really seen issues with that. But in general, you would do oral TXA and CBD and GHK. That's the Dr. Emer
Got it. Wow.
internal melasma combo. This is the first time, FYI, the first time I've ever told anyone that except for my clients. I don't put it on
That's
Instagram
amazing.
at all because I don't want anyone stealing all my shit.
Well, I
'Cause they
have
always do.
basically done that except for the CBD part.
We need to add it.
We're gonna
add medical grade. You need the high
found
dose.
out about the oral Transexamic. No doctor would prescribe it
Oh,
to
I
me.
do it all the time.
I lied. Sorry. And I was like, I need it for periods.
Okay, well that
And
works.
I got on it and it cleared things, and
Yeah.
I'm
What
not
dose
on
do you
it right
take?
this
Oh, okay.
second because I am a little bit of a biohacker myself.
That's good.
I like
I can
to test
tell.
things out, so I'm not on anything.
Okay, 'cause
and
you like
I'm-
to test one
because
thing at a time.
I'm trying to test the copper.
It's hard for me because I always tell people, if you're on 4 things and you improve,
Yeah.
just take them all. Because who knows?
Well, yes, and
Unless
I
there's
will
no
go
side
back
effects.
to that,
Because it's
but-
hard for me. Like I treat people with hair loss, and when someone
by
comes
the way,
into
I'm
hair
dealing with.
loss, so we'll talk about that. I don't want them to progress as I'm
Yes,
trying,
yes.
or even if it's slowing down, you still may notice some hair loss.
Right.
So I just hit it with everything because that's one of those things. And the same thing goes for erectile dysfunction, which I know you don't have, but
But I have experienced.
okay, I want to hear about that. Because wait, let me talk about the hair loss. So on hair loss, one of the things we do that's unique, and I also have never really told anyone this, is we do PRP injections to the scalp, especially for women.
Yep.
But we add the GHK to it. So GHK with a little bit of progesterone. And that is the key.
Progesterone?
Yeah, progesterone. Because remember,
In the
hair.
actual... wow.
Yes,
Okay.
and not orally, locally.
Yeah, locally.
But here's the thing: your hair in women, it's not as regulated by hormone, but women do have testosterone.
Yes.
And it changes.
That's why
and
there's
as
all of the DHT
exactly.
blockers, right?
So
Yeah.
that's why women can take some of the DHT blockers as they get a little bit older. I probably wouldn't give it to a younger female, but progesterone locally then shifts the balance between DHT, and then you have normal hair growth. And it's
Wow.
probably the best treatment that exists. The problem is the government's starting to regulate a bunch of medicines.
Sure, yeah.
One of them being hydroquinone that someone was mentioning to me earlier
I love.
before this, which I do too. But that's going to be off market, and very soon
What?
it's going to be very soon. There's going to be very few things that have it in it, which we can talk about at any time. But progesterone is probably the best
just got,
treatment,
like, the
but it's
worst
really
news ever.
hard. I know it's really hard to get the compound that would allow you to take the progesterone oil and make it into a solution, because you
Yeah.
can't inject the oil into the scalp.
Right.
So we're doing a lot of those alternative therapies. Women it's really good for, because women get a different pattern in hair loss that doesn't need transplant usually. Men have patterns where it gets really bald in different areas, so they need a transplant early. Women get what's called like part width distribution, where either the temple triangles or the center part width start to thin. And you'll see it more in like Asian and Filipino women at the beginning.
Interesting,
And
yeah.
you see that, like, you could actually see the scalp starting to form and thin, especially because they have thinner hair to begin with, that it just becomes that way. So if you treat it early enough, I have patients in their 90s that are on that plus oral spironolactone, and they don't get any hair loss.
Did the oral, but that was for acne.
Yeah, I tell people honestly to take it forever.
Oh, okay,
Girls,
interesting.
unless you're having kids. It's the
Yeah,
only
yeah,
thing you
yeah.
can't. But it decreases oil. It decreases oil production, and it strengthens the hair.
Oh, wow.
So there's no negative
That's
in
amazing.
taking it.
So I got pregnant.
Okay.
I don't have children.
Okay.
That's one way to say that. And lost like 50% of my hair.
Oh yeah. So that's telogen.
the
Yeah.
fuck up.
So in this case, had you come to me, and we had done NAD,
that's the theme of this
BPS,
podcast. Had you
that's,
come to
that's
me.
what it should be. You need to come to me, and if you haven't seen me before, you must come.
Yes, basically.
Is if you found me first, we would have done. So in this case, we would have done IV NADs with BPC and the injections with the copper and steroid. We would have actually injected your hair with
keep it from
steroid.
falling out.
Yeah, because in telogen, which is different than you're describing, which is, we were talking about androgenetic hair loss, which is genetic. Telogen stress.
Yes,
And that
which
could
is a
be from a
hormone
heavy
drop-off,
periods.
yeah.
It could be hormones. I actually have seen it in people who've even been in like car accidents, where like
believe
it's
it.
just a stressful, anything that you,
Virus.
family members have died, you've been sick. Yeah, exactly.
Yeah, totally.
So girls get the more hair shed than guys
Yeah.
tend to get that. So with women that tend to have telogen, you need to do more aggressive internal inflammation reduction and these injections.
Yeah. And so
So-
I didn't do that. And then
Wow.
it was brutal.
So what happened?
I went on minoxidil.
Okay, well that's good though. But
Okay. But then
happened?
I wanted to get off of minoxidil because I noticed a couple of gray hairs, and then I Googled it and was like, oh, I think maybe it's speeding it up, and I freaked out.
Oh, it probably wasn't.
Yeah, well, my bad.
It's okay.
So then it happened all over again.
Oh,
and
no.
Yeah, I know. I mean, it's fine.
Because it takes 3 to 6 months to see the repair.
Yes.
So
And
that's why I hit it really quickly. That's why in something like that, I wouldn't wait to do a testing phase
well, this is why it's really bad to test things out
on yourself. I know. This is what I always tell people. Listen, don't go to my YouTube and try and do those things at home, or don't go and use chat now. Well, before it was Google it, now AI it.
Yeah.
If you AI it, and you're going to look up and it's going to tell you what to do. It's like literally a recipe for anything.
Yes.
People will go and start to do it. So I'm actually, it's funny. People go, don't you get concerned that like people are going to, jobs are going to be gone? I'm like, not really, because more complications are going to occur.
Yeah.
Because people are going to follow what an AI tells them. And it doesn't mean that it's actually an expert guidance, because most things are customized.
Yeah.
They're
always
and I spend a lot of time
tweaking
with people, focusing on what's important. And my patients, I would say 80 to 90% of them stay with me forever. So you get to know them. It's like I tell people, like your dentist or your hair person, like you want that person all the time. You don't want to get rid of them if they're good.
Because it sounds like, correct me if I'm wrong, but it sounds like your mission statement and your drive is to truly improve the quality of your patients' lives.
Yeah, and that's the thing. So for me, my grind was being the best I could be in the medical part, was being the best I could in my field for my patients, offering them treatments that would help them, because I had so many patients where they just go to a dermatologist, get another cream, and then it doesn't work and this, and I'm like, that's not going to even treat it.
They're told, oh, well, that's actually like you've got a chronic condition, you have it for the rest of your life. Like, unfortunately, we don't really know what to do. There's not a lot of treatments. I'm talking about melasma. We're really bringing it back. But yeah, like something like that, or I don't know, another condition that I don't know of. But then you go, wait, this is crazy. This is an authority figure. They're an expert in this topic. Like, so this is it? Like, I just have to live with this?
Yeah. I know it's hard too, because sometimes when let's say meet someone for the first time, you consult them on something that has no cure, they get very frustrated, but I always tell people, just because something doesn't have a cure doesn't mean that it can't be controlled.
Oh, yeah. I also have like a very non-medical outlook on that. I don't believe that.
Don't believe that it can't be controlled, or that it can be cured.
Well, cure. I think like if it doesn't bother you anymore.
Right. Well, that's true. Who cares if you have it? Yeah,
right?
exactly. It won't even matter.
Technically, I have CFS. I have chronic fatigue syndrome, but like I'm living at 100%,
and you look energetic.
6% chance, but I, in my mind, was like, absolutely not. There's just no way.
I also used to do a lot, and this is another thing. Again, the whole TikTok generation is, last year it was like neck Botox, Barbie tox, or whatever they called it, but elongating the neck and all this. And I was like laughing because years before I've been doing, they call it trap tox to slim their neck and everything. And I laughed because I was like, I've been doing trigger point injections with lidocaine and Botox into trigger points for years for people with chronic fatigue, like me, because I like literally have so much. Yeah, that's over here. But on the neck, let's say someone had Tourette's where they tick all the time, go like this, or dystonia. When I was in my fellowship, I'd have kids where their neck would be stuck like this from medicine and from genetics. It just can occur. And so this is 2006 and 7 that I was injecting there. But TikTok made it look like this just came out.
This is new.
Brand new.
Yeah.
I've been injecting calves to reduce calf size and penises for erectile dysfunction, which we're going to talk about.
Oh my gosh.
Everyone's experienced some level of erectile dysfunction, haven't they?
And if you haven't, then you're lying. And I know because I've hosted a sex podcast for 3 years.
Oh, I know. This is we have to talk about it more. I was just telling them, I was like, are we sure that we're picking the right themes for my podcast? Because all I do all day, literally half of what I do now is, we call it down under treatments. But like yesterday alone, I did 5 penis injections, 2 vaginal injections, had consults for scrotox, anal tox, and then I did surgery where we did penis treatments. So that was one day. of my practice.
That's
And so I
iconic.
literally hear the stories
So LA.
of what I hear. I know, but you know what?
It's actually not, though.
No, it is very, I think, LA for someone to talk about it.
That
and
part,
it be
yes.
out there, like
But
me
everybody wants it.
describing it.
Yeah.
Right, they want it, but they don't talk about it.
100%.
And so for some people feel comfortable with me. I don't know if it's because I'm gay and they know I'm gay, so guys will talk to me because they want to relate, and girls will also talk to me. So yesterday I'm injecting this woman's vagina. Her husband's in the other room because I'm injecting his penis, actually, in the other room. And
What a
she's
love
there
story.
and she's like, look, she's like telling me what to tell him about their sex and stuff when I go over there. And she's like, I like it really like plump and really full because he loves it and he loves to slap me when it's like full like that and stuff. I'm like, she's like, so go in there and do this to his penis and tell him like about this, what he needs to do, you know, and like this
You're
is
like
my
now a
day to day,
therapist. Yeah.
literally my day to day. So nothing at all phases me.
Yeah.
Anything someone can tell me about what their sex life is, what they do regularly, then I just hear all this different stuff. It's so crazy. But that's why it doesn't faze me that people want treatments there.
Yeah.
And the majority, honestly, probably, and the cosmetic part, don't really need it. Like the woman that I was describing to you, she's very beautiful, very athletic. Her vaginal lips were fine.
Yeah.
But she they're a little dry, like a lip up here. She just wanted plumped. So I always tell people, if it's dry up here, it's
So
probably
like a
dry down here.
Hyaluronic profilo
Yeah, but she did
situation?
permanent actually.
Oh.
Because we've already done hyaluronic and she
Okay,
loved
okay.
it. So now we did a combination of HA with Bellafill, which is PMMA. It's permanent. So
wow.
it will thicken and form collagen there.
Wow.
long
And
term.
that's specifically for like those lips?
Well, it's made for acne scars.
Okay.
That's what it's approved for.
Yeah.
But I use it off label,
Off-label, yeah.
again, being a
well, that's
crazy
the thing.
scientist.
The best things are off label.
Yes, I agree.
mean-
So it works really well for her to create more structure in that area.
Cool.
I do
That's
that same thing
amazing.
for guys' penises.
You do.
Yes, it's on my Twitter, you guys. I can't show it on Instagram, unfortunately, and YouTube. Although my YouTube has been blocked
This is
numerous times.
Amazing, because I'm like, so we could help people.
Yeah.
Besides.
Oh yeah. I can show you. I feel like I should just show you some pictures
My
and
head's
see
going
your
to
reaction.
explode.
Let me pull one up here.
That's
I'm gonna pull up one
amazing.
because last night I was at dinner and I was actually showing my people at dinner this, and they were like, "Wow, it did get longer too." And I said, "Yeah, it does get a little longer, even though here I'm gonna pull up a couple good
And
ones."
does it change their experience of things? No.
No, so
Because
it's not a
just like getting,
sensitivity
like,
thing, but
filler.
we do. Here's a couple I'll show you. So this is a good example. This is a more of a larger one. Look, to show you that one. That's a big change, right? So he
A
wasn't.
big change.
So he was. What would you say the before was, if you had to describe it?
I would say the before is like a banana.
Like long and thin.
The after is closer to my water bottle.
Good. That's a good example. Or
Yeah.
more like an eggplant or a cucumber.
Yeah.
It's
Oh, yeah, I
perfect.
guess.
Good. If we're gonna go the route of what
Sure,
you're
yeah,
describing.
yeah.
How about? Let me see. This one.
Also, by the way,
This is another good
this
one.
is like my favorite game. Oh
We need to do this on your podcast, I think.
my, yes, and also, I don't even one is the size of his balls.
That's
one
true.
is the size of like
Half an arm.
half an arm.
Perfect. Although this is actually really good because it's very even. So this is like the one I just showed you is a conservative treatment. This is
That's
like doing 2 or
conservative?
3, getting probably another couple inches around. Exactly. But you see there was length. That's what I wanted you to see. So look at this one. How about this one? Because this is the last one. I think it's a good example.
Wow, that's changing someone's life.
I know. So I want to tell you about this guy. I'm going to tell you specifically.
That one started off as a sneeze,
Yeah, I would say turtle.
and now he
Turtle
has a
head.
dick. Yeah.
Exactly. Now he's more of like the snail that actually came out.
Yes.
Full snail head all the
Yes,
way out,
yes,
but much
yes,
larger.
yes.
So this patient of mine just had a very small size, but he has multiple kids, his wife, totally happy. This is a good example of how I feel like,
because I'm single.
yeah, I mean, listen, he's totally happy. No problem. But you never know. It's not always about
I know.
that. you
Oh,
know.
don't I know?
I know.
Yes.
It's okay. Now that I know you have a bunch of people I can introduce you to that I think you'll love.
Actually, as we should say on that, I actually try not to like shame people, but one of the things that I think is so fascinating is like, 80% or 83% of women don't come from
I know this. I talk about this all the time.
like vaginal intercourse.
Yes,
so
they don't have orgasms at all.
I mean,
And I want to tell you something. I had a patient. She's actually my patient for 10 years. She never had orgasms for 10 years. And so then she just stopped dating. And she lost a bunch of weight. We did some surgeries. And I said, you know what? Let's do the O shot, which is where we do the PRP with Botox and stem cells into the vagina and the clit and the G spot. And then I did a laser.
How do you get to the G spot?
A long needle, a very long needle. Yes. And you have to know, again, I'm gay, but I know where to go with the G spot. So I think the girls like that I know exactly where to go. Exactly.
Holy.
And a doctor. So I can identify it, inject it. Exactly. It doesn't feel the best, but a couple days later, we knew she was going to go on a date with someone she thought she was going to have sex with. So I said, okay, we need just a couple days before.
We always know.
So 3 days before, it was already set up. And I did something called the Juliet, which is a laser inside the vagina. It actually makes circles like this. It lasers the canal like this in circles all the way around.
Laser or red light?
No, lasers.
Laser, okay.
So this is different, not radio frequency. This actually lasers.
Right?
Yeah, and it contracts it. And then as it's healing, it produces moisture.
Very cool.
So I did that.
Okay.
So 3 days later, she sends a text to my fiance and says, I've had 8 orgasms. It was the best thing ever. And guess what? She's engaged now.
Yeah, she was just like.
So she gets her O shots on the regular. So sometimes it's blood flow, it's moisture, it's sensitivity.
It is blood flow.
And that was that plus a peptide called PT-141. So do you know that peptide?
No.
Okay, so PT-141.
I wanted to get to know it intimately.
I will. I think it is an intimate peptide. So PT-141 you can do it in injection, but I like the nasal inhaler better. So a few times a week, it stimulates your body to increase circulation and help the nerves become more sensitive. If you do more than 2 days a week, it alternatively affects the melanocytes on your skin and makes your whole body tan. No, actually, it won't make melasma worse.
Oh.
It just makes you tan, your whole body.
Oh, I do know what
So some people call it melanotan. But if you do it at a low dose, it has neurotransmitter release and blood flow. So I feel like with Botox injected there and the PT, so basically every guy that comes in that talks to me about girth enhancement, I always tell them, we need to do the P shots for health, because you're going to lose sensitivity over time. You're going to lose desire, drive. You're going to lose the ability to have like hard erections, which girls need when they want to have, and if the girls don't have good orgasms, then they need to figure out, is it sensory? Is it brain? Because sometimes it's just what your thoughts.
Yeah.
And sometimes it's the moisture of the skin.
Or the muscle.
Yeah, exactly. So that's another. So that's the thing.
There's a guy that is called the Orgasm Whisperer.
I have heard about this. I know. A couple of my patients have gone to him.
I have worked with him.
I think we need to get him in to my office. Would he do a P shot on Twitter? Live.
Oh, I'm sure he would.
Oh, I will give it to him for free. Orgasm Whisperer. If you're listening, we're going to whisper to you. If you're listening, I will do a P shot for you for free, just so you can help more women get orgasms.
Yeah, his whole thing is that, like, I mean, what is an orgasm? It's a contraction.
It is. So that's why there's a device called Emcella. Do you know Emcella?
No.
I think that's what it's called. It's a little, like a toilet, looks like a toilet that you sit on like this, and it vibrates 1,000 times to help your pelvic muscles strengthen, so that women can do, it's basically Kegels or whatever, but it's a machine doing it for you.
That's helpful for.
And it's very good. Yeah. So women that have prolapse or like pelvic issues after having kids, this helps them
I
get
have a
back.
vibration plate.
But that it's similar. Yeah, it's similar to that. It's just the pelvic version
of that.
like the doctor's version.
That's
of it.
so cool.
So
anyway, just
maybe we
cut
can
you
get
off,
them to
but,
donate one to your podcast.
They should. Yes. Hell yeah.
Maybe I'll sit on it. See what happens. Never done
I
it.
can tell you what's gonna happen.
I don't know. We're gonna find out. I have no clue. But what? So wait, what did the whisperer say?
Just that if your muscles are out of whack, how can you think it's not going to affect your sex life?
Right. So I think the lasers actually help the muscles too. Because if you think of lasering your face, it tightens everything.
Yeah.
The same thing occurs internally. But again, you have to address, just like aging on the face, you have to address every level. So I always tell people,
external.
right. So I always tell people your skin. So when someone comes to me for the face, I have it. Sometimes honestly, I get bad reviews because like he quoted me $100,000. And it's not that I quoted him $100,000. I went through every layer of their face.
Right.
And I said, these are the treatments you do for aging. Doesn't mean you need to do them all.
Or do them all right now.
Right, exactly.
Yeah.
But that's the thing. I get that all the time. Oh, then they told me to also do his skincare line. I'm like, but I've been using skincare works. That's why I developed it, because it it's better than the ones that they push to you that don't work. So basically I'll
Also,
go like
it's about consistency.
yeah, you just have to be into it. You have to be into it.
I know.
And so that's the thing. So on the face, you have the bone structure, you
Yeah.
have the skin that becomes lax or volume, you have the texture on the surface, which is your collagen and sunspots, and then you have the fact that you may need surgery. So you have all these things that add up. It doesn't mean you need to do them all. If someone has a priority, like they don't have a cheekbone, okay, just do filler there.
Sure.
But if you have like, oh, I'm starting to droop because I lost a bunch of weight, well, that is now more,
big now,
it's a lot,
yeah.
right? And that's why I was going to bring that up because it's the next peptides. But that is, you now did you do a lot of things. Like those are energy treatments to heat, and that might be every few months. And that's also ultrasound to treat your muscle. That's twice a year. And then threads to lift everything, and that's once a year. And so like, if someone goes, I don't want to do that, or that's fine. But those are things
ultrasound over radio frequency?
I do both.
Yeah, both. Okay.
So that's the thing. So I do ultrasound twice a year, and I do radio frequency microneedling every 2 to 3 months.
I just did thermage.
Okay,
with
so I was like
Korea.
I was like the thermage person for years and years and years. I call thermage the clock stopper because it slows it down. I don't think it really reverses. It's very big in Korea on all the new Korea, like 6 treatments in one.
Yeah.
And the
But
thing
those
is,
are like watered down treatments.
Yeah, they
Nobody
are.
really wants to talk about the fact that they have crazy anti-defamation laws.
I know.
All of these are influencers that are going.
I know.
and
They're all getting it for
paid
free.
for it.
I know.
Yeah.
And I always reply to them and I say, I've been doing that for 15 years. There's nothing new here. Plus, these are all old
And
devices.
you're getting like, I've done a lot of those treatments, and it's like, that's not what Fraxel looks like.
No.
That's not what Cool Peel looks like, or whatever.
know.
You know what I mean? Like,
But they're getting something like it.
Sure,
And that's the thing.
yes.
So like a thermage to me is you would do it once or twice a year forever. And then if you look at yourself at 40, when you've been doing it since 20, everyone else your age that didn't looks better. That's how I think thermage works.
yeah.
Same thing with ultherapy. I think ultherapy is like, or ultrasound now, soft wave is another one.
I did that last year.
It's great. Yeah. So soft wave I do 3 times a year. And then, about 3 times a year. I do a series first and then every 4 months. So that's the thing. I put that together every year for someone.
Sure.
Well, that may be hundreds of thousands of dollars, but because it's a million treatments, but it doesn't mean that everyone's going to do that. If someone had the money, that like people go to me, why did they look so good? I'm like, well, they literally do a facial
Because
every
decided
2
to do
weeks.
this instead of
They
get a
do
house.
right, exactly. They literally go in, or they just have so much money that they can. That's the
Yeah.
thing is, and not all of it's very expensive. It's just you add up a million things and they become a lot. So like I get these reviews sometimes where they'll be like, he quoted me $12,000 for an acne scar treatment. I'm like, no, it was 3 lasers, 2 fillers, threads because you had loose skin, and when you go like this, the scars improve. And all the healing stuff in one treatment. You don't have to do all those things. You could literally do 1 laser,
Right, yeah.
and it's $1,500.
But then don't be upset.
That's the thing. And that's why I'm starting to reply to some of those reviews and be like, when someone calls you out, you can kind of not break HIPAA, you can't say their name, but you can then reply and say, well, in our conversation, that's not what we said.
Yeah.
So I started doing that 3 weeks ago. And other people who never went to me are like, I'm not going to go to that doctor because he talks mean to the patients. I'm like,
well, thank you.
that was because the
Bye.
patient said something bad to me.
Yeah.
I was like, I'm defending myself. I was like, I'm not
Leave them
even
out, though. You don't want
I know.
those kind
And
of
that's the thing. And that's
patients.
what I like. I'm like,
Yeah.
the ones that come to me are like, they'll actually quote those and be like, I went to you because you called out that person's shit. I was like, yeah.
Well,
or
I
like I have
mean,
patients that
I
go to
think
me.
It's insane to think that you would be like,
I am
you're
realistic.
the Bentley of like, so if somebody wants a Toyota, that's amazing, and they should absolutely get that, and that exists in Los Angeles, that exists in New York, that exists in whatever.
Yeah, one of my
town you're
clients
listening
calls
to
me
this
the
in.
Rolls Royce.
And and then
That's what he says.
But if that is what you're looking for,
Yeah.
then that is
Yeah, like
what
with
you
me,
offer.
for me, I like I've had veneers. I haven't really done a lot, but I've had veneers. My friend's, I think, one of the best veneers doctor here, and he's like, "Don't worry, I'm gonna hook you up." I go, "Do not give me a discount. I'm paying for your expertise because the teeth you do, no one can tell. So I want the best, and I don't care what it costs." And he's like, no, I'm gonna you send me all these patients. I'm like,
I need you
so
to
I
do your
actually
job.
paid him the real thing.
yeah.
And then he was like trying to show me these animations and all this stuff. I'm like, no, I don't need that. If I know someone's the best, tell me what to do.
Yeah.
So I had a patient the other day who comes in, I think every 3-4 months. He's a very, very attractive guy. And he came to me a year ago because his girlfriend gets Botox from me, and he was like, I think I should start doing some anti-aging. But he had a chin that was all the way back here, and like there's this little optimization.
Sure.
And so I said to him, here's the treatment plan. He goes, look, just tell me what you want. I trust you. I see what my girlfriend looks like. I've seen what you do online. He's like, I don't care the cost. He goes, I have unlimited budget. Do what you think is best.
Yeah.
And I don't remember what it cost. It was expensive, but it was filler, Botox, laser. So then now for every 4 months, you know, now it's little bits. It's not as much as it was at the beginning. It's little things. But now when he came back, I've been seeing him in like 6 months. He just came back the other day. And he's like, okay, what do I need? And I was like, well, this is now back more, you know, here's the plan. He goes, can we do it right now? Like it's only about looking and feeling your best. It's not about, oh, what are you, let me get a deal or let me figure out what the pricing is going to be because, you know, it's about getting the best result. Basically, I don't know how to describe it.
Different, you know,
right? And if someone has,
goals,
but I always say if someone has a budget, we work in the budget.
Sure.
Like if I go, I want you to do this to your face, and they're like, I can only afford 2 syringes. Let's pick the area that's gonna be best for you. I got a girl the other day. I just did her chin. Then another girl where I wanted to do her cheeks and other areas, but lips were the most important to her, so we did the lips.
Yeah.
And so you just isolate it. I think you can't blame somebody. It's just like when you go to Hermes, everyone wants the exotic, you know, bag that's $200,000 because J-Lo has it or something. I mean, she takes it to the gym, literally $250,000 bag. But you may be only to be able to afford a scarf or you start there and you work your way up. I don't know.
Right. Yeah. I mean, look, everybody's gonna you can be mad about not being able to afford something. That's fine, but don't get mad at people for pricing things. Like
I know, that's the thing. Most of my reviews are the pricing. I had a review yesterday about my consult fee. I'm like, the consult fee is a credit.
To weed people out.
I actually use it as a credit. Well, I mean, the person wrote a bad review, and he said that someone was mean to him on the phone. I listened to the conversation. She was so nice. She was like, we really would love to get you in. I already can tell you're gonna love him because he's gonna address everything that your concerns are.
I have a hypothesis.
Yeah.
I think that
I want to hear it.
Well, I think that what you offer is, so you do a lot of things and you do a lot of things at a high level. And I think that's intimidating. I also think doing it in Los Angeles is very intimidating. And so when people come to a surgeon's office, they're confronted with a lot of their insecurities.
Yeah, that's hard.
And so they're going to be coming, not everybody, but some people are going to be coming to your office and they're going to be dealing with you, but they're also going to be dealing with them. And they're going to be dealing with the parts of themselves
my staff always says, look, it's not you, it's them. Because I'm really honest with people. I give them every single option you could possibly have. And then I say, you don't even need to do that. Just start with getting facials.
Yeah.
Like even melasma, if you can't do lasers or big peels, like Cosmelan is pretty expensive. And you know, it's funny, I charge a pretty good amount. I know. I charge a pretty good amount for Cosmelan because we have a very detailed protocol. My esthetician every single day.
It's no longer, right?
No, Cosmelan still exists. It's just not it doesn't have the hydroquinone in it. It still exists, but it's not HQ.
Oh, so they reformulated.
They reformulated
I thought,
it.
yeah,
Doesn't function as well.
The peel no longer exists.
No, the peel exists. I'm actually number 2 in the country use of Cosmelan. The owner is my friend. And when they developed the new one, I was like, this isn't going to work for my protocols because I do very strong lasers. And to prevent the pigmentation, I need Cosmelan. And so I developed a protocol with my products.
I do that before lasers too.
You should do it before and after,
retinol
actually.
And a hydroquinone.
But that's what was
retinol.
No, I don't like tretinoin.
Tretinoin.
But I love retinol.
Okay. Yeah.
That's why my retinol,
skin that way.
which I think you would love, because it's really good for your skin tone,
okay,
is a hyaluronic acid infused retinol that's long acting. So you can actually use it on the eyelids. We did testing and we got it ophthalmological approved.
Oh, amazing.
So it's very, very useful. And you can use it post and pre-laser to actually help it heal faster.
Oh, awesome.
So it's really cool. I've never had anyone be irritated from it ever yet, knock on wood, but it's been very, very, very useful.
And it's
people love it.
Now? Or
It's a all trans retinoic acid.
Oh, okay. Wow. Cool.
So what else was I going to say?
So going back to dicks.
Yes. Yeah. I would love to talk about dicks. I'm considered the dick doc, I guess.
I love
Although there is a dick doc on TikTok. That's not me. I should have gotten that name actually probably, but our website probably soon will become massivemember.com. That's what we're going to call it.
Cool. I can't wait to get a card.
Yes, exactly. I need to create one for girls. I just have to think of what it's going to be.
We want the massive member.
Yeah, but we're going to have that there. Don't worry. And we're going to have on there, if you send your girlfriend, wife, or mistress, we'll take care of them. No, I'm kidding. But I mean, you'd be surprised that
I would not.
The people, the people come for.
Yeah.
And like I had a guy yesterday who came, didn't even speak English. First I was doing translation, then I had Jose come in because he speaks Spanish. And he was showing me every erection photo he had and why he needs a little bit bigger because all the guys claim it's too thin. This is what he was telling me. And he was like...
I love that he's getting in real feedback.
And he was showing me up close, like the iPad, like zooming in on his penis, which was big, very big. And because he's from like El Salvador, Salvadorian or something. So I was like, that's big, you know. I was like, what's wrong with this? Like, that's the thing. Sometimes I don't understand. Then I had another young guy. This was incredible. Never had this before. And I do probably 3 to 5 virtual consults a day for guys that fly in for this treatment. And I love doing it. I never knew I'd be the artist of dicks, but I guess that I'm going to be. You got to videotape this right now for Agnes. He's going to love it. And I'll tell you what that is in a minute off the podcast. So, no, I've never thought I would be like the artist of dicks. Yeah. And because I just was interested in it at the beginning, and then it became something I like really, again, wanted to be progressive, be the best. Yeah. So I figured out the technique to make it really good. And I had... I lost my train of thought. What was I talking about?
El Salvador, thinner. His
it was something
really
after
big,
that.
But you were like...
He was going to tell Agnes about
No, I know. That's why I lost my train of thought.
It was
something
about
him.
like that his dick was like, he wanted it to be bigger, and then he was getting all this in real time feedback. You wanted to be the best.
I know. Let me think about it. Hold on.
Never thought you'd be the artist of dicks.
Why he wanted bigger, because that was looking perfect bigger. But
it was already perfect. I know. I can't remember now. But listen.
What? You use copper.
Yeah, so let's talk about that in a second. Yeah. So I'll talk about the size. So you'd be surprised because like this guy, that was the El Salvadorian guy, Salvadorian guy, his dick, I think any girl would say looked pretty. Like any guy would probably love it. But he was like tormented by people telling him it was too thin. I was like, that's bigger than most guys that come to see me. So I was like kind of shocked that he would, but the thing is, the bigger you are to start, the more you're going to need to be able to make it. So I pulled up some pictures and showed him. He was like, I want that. I love that. I'm going to do it. So I think he booked for next week. But what I was saying was I didn't realize, and he was uncircumcised. And most doctors that do this or have been trained in doing this can't do uncircumcised because it's very difficult to make regular and symmetric and make look nice. And so I developed a technique where I can make it look good, at least good enough that it's better and still looks, and it doesn't have any asymmetries.
It's not going to look like
it was done or
toyed
anything.
with.
Yeah, exactly.
Yeah. Okay.
So cause in the past, we used to have people do a circumcision before. So it's hard to tell a 40-year-old or 30-something-year-old, like, you need to get a circumcision because they tend to like it. Snipped. And so when we do the penis injections, we also do the pee shot with it because it helps it heal more. Plus, we find that with the blood flow and the collagen production from the peptides or the growth factors and the stem cells that are in the PRP and the Botox with the blood flow, collagen production's better, especially with the copper peptide, and that helps the permanent filler because the permanent filler thickens over time. It builds over time. And so when I didn't do it with it, the penises didn't get as big. And then because it didn't grow as much. And now when we do it, they get much better. So I have people years later where I'll see them and it's like, they're like, my hand, I could feel it heavier.
You're like,
over the time or whatever.
That's what you asked for.
They love it. Yeah, they loved it. Wow. So, I mean, this is the story. Like, it's always about the stories. I get a lot of them.
Yeah.
A lot.
Well,
I have some guys, like I had one guy, very good looking younger guy that his girlfriend had just broken up with him and told him he had a small dick, which he didn't. It's very big. He showed me the erection photos.
Like
they were at least 8 inches, at least, and it was thick. So he said, I need it to be bigger because I'm going on this trip and I'm going to be in Speedos and I need to take pictures that she's going to see where my bulge looks really big. I said, just get an erection before. Fold it.
Wait, what's that thing
and
they
just
do
get
in
hard.
Brazil?
Wait, in Brazil they get erections before?
No, to make their dicks look bigger on the beach.
Oh, I don't know, but I
Oh,
figured they all did
gosh.
the penis injections.
Yes, but
Maybe
they're
they pump.
short.
Maybe they
They
pump before.
But
that makes
because
sense.
I had a guy friend who was like, yeah, like I'm at this nude beach and everybody's like just stacked. And
I know in
then
Brazil they're all like that.
I like
It's crazy.
got up close to one and saw all these like marks on it.
Maybe they were doing injections.
So it's injections, but I
Maybe.
think it was like a short.
Well, maybe it was maybe it's just the PRP because that does the fluid makes
maybe
it like double, triple the size.
Maybe it was okay. So maybe it's
So that's crazy.
Yeah.
Oh, they're all doing pee shots. Well, then they're gonna have erections on the beach, for sure.
Yeah.
I had a guy once recently when we did. He used to do the pee shots, and he thought it was good, but he had never chose to do the Botox into it. They call it Bocock now, but so we injected.
What does Botox do?
It nerves, so regulates nerves. So more.
Okay.
That's why I like it for the girls' clits because it gives more sensitivity.
Yeah.
And it increases the blood flow. So he sent me a picture in gray sweatpants with an erection at Target. And he said, I don't know what to do. My penis, it keeps getting erect and I'm at Target.
Well, smile, buddy, because you're about to be a meme.
Exactly.
In gray sweatpants?
We can make one. We'll make a meme. This will be great.
I feel like.
But imagine you're at a family-oriented Target. And now you're getting the hardest, biggest erections you ever had in your life.
God, he's gonna end up on some list.
This is what Dr. Emer is gonna be known for. This is it's my fault. And be like, Mommy, what is that?
Oh my God.
Be like, Donnie, don't look. It's like be like crazy. I don't know what's going on, but you know what?
That's a pee shot.
It made him so happy.
That's
But
amazing.
people now are at least talking about it, which is what I like.
I think it's great. I mean, like, you definitely I think people are so honest with you because you're dealing with two things that are really embarrassing to say. Embarrassing to be like, I don't like the way that I look, or even more embarrassing, like I'm not able to perform or I'm not able to enjoy sex the way that I was told is supposed to be just normal.
And that's the other thing too. My first client, one of my first patients was probably I think like a 90-year-old Jewish woman on the Upper East Side who was a Holocaust survivor. And she had terrible psoriasis. Her whole body, 90% of it covered.
Makes sense.
And so she had never been in, and it's funny, during the Holocaust, she never had psoriasis actually.
Yeah.
No, she said to me, the most stressful time of her life when she was in the Holocaust, she didn't even have psoriasis. And then when she moved to New York and all this, then the psoriasis came. And it's a whole long story as to why I know it's crazy. The love of her life died and all this stuff. And then for years, she never was with anyone. She's doing our clinical trial. 2 shots of this medicine, whole body clears. Full body. She's a beautiful woman, right? For 90. And a couple weeks later, no, this is the point. This is the point.
Okay.
Couple weeks later, this is 2007. We didn't really have the pee shot then, but it would be O shot for her. But either way, 2007. So 2 weeks later, 2 or 3 weeks. No, it was a month because every month she came in for treatment. So she came back, and she's with her 87-year-old boy toy, George.
Love that for her.
He was he was a veteran, so he was in his thing in a walker, and she was like, "Meet George." And she looked so happy, and I turned to her and go, what's different? She goes, I'm having so much sex. You have no idea how good George is. And I turned, and this is my first year of being a doctor. I mean, because I just graduated, and I was in my residency, and I go, I realized sex was so important to everybody.
Yeah.
It did not matter age.
Yeah.
I had another story the year before when I was in my internship. I did an internship around an area where there's a lot of nursing homes. And every night I would get called in for whoever was screaming in the nursing home, and they brought her to the emergency room, make sure something's wrong. Nothing's wrong, because there's something called sundowning. I don't know what that is, but when the sun goes down, the older people start to go crazy. And that's because their medications affect their brain.
Okay.
And when you start to lose it a little bit, unfortunately, that's why I want everyone to take peptides to prevent this from happening. They, get like an Alzheimer's like reaction.
When they get,
yes.
When
but
their circadian rhythms get off.
Yeah, so that's why people put people on like trazodone or
Yeah.
Ambien and stuff every night at the same time, so that their REM sleep is exactly the same and they don't get a sundowning effect.
Okay. Wow.
As you get Alzheimer's and things, as you get a little bit older, or let's say any type of dementia, it can worsen earlier in life. So I once had, they're like, call me again, they page me. Remember, I'm a pager. And I what's going on? They're like, we have another sundowner or whatever in this room. And I go into the room, and the lady's like talking gibberish. I'm like, this can't be sundown. I thought it was a stroke. And then, I'm a dermatologist, or I'm going to go into dermatology. It was my first year. I didn't know anything about dermatology, but I saw that she had a rash. And I was like, this is interesting. So I called them. I'm like, I thought you said that nothing was wrong, that it was just like a sundowning effect. They're like, no. They said, yeah, why? What do you see? I was like, well, she has a rash. And they're like, well, I was like, for how long has she been acting this way? And they're like, well, for the past 2 weeks, they gave her these new antibiotics, and they thought that this rash was from the antibiotics. Whoa. And I look at it and I'm like, this is weird. So I didn't know anything about derm, except for the fact that you had to look at all. Yeah, I wanted to get into it, and you had to look at the full body. And in this case, I looked at her, and on her hands and feet, she had the rash.
Oh my gosh.
Now, drug rashes, if you look in the book, those don't occur on the hands and feet, except for rare ones. And
that's
the main one
for STIs.
Exactly. Yeah. So what was the rash? Do you know?
Hand, foot, and mouth?
No, that would be in kids.
That would be a kid.
That's good. That's in kids.
But is it the same thing?
Also, hand, foot, and mouth, for you guys to know, moms out there, it's very painful. So this was no pain. 0 pain, rash on the palms and feet. Anyone know? Anyone in the audience?
It's not the same thing?
What is it? Sure. Anyone? You were right, though. It's an STD, syphilis.
Oh.
So.
Okay, that's a little before.
So it's okay. Well, people, it's big in LA right now. I know, the billboards everywhere. Never mind. Everywhere here, everyone's going to get syphilis and gonorrhea in this city. If you look at every billboard as you drive around.
I was like, oh.
No, I'm saying it literally says everybody has it.
I'd rather not.
In LA, everyone has syphilis and gonorrhea.
Truly.
So I go, oh my God, this woman probably has syphilis. And I don't know. I'm not a dermatologist yet, but I'm in my first year. And so we do the test, and she did. It turns out IV penicillin, because it's in her brain. It's in her brain.
So it wasn't the sundowners. It was
she's spirochetes in her brain. I know. But the reason I'm bringing this up is, turns out the nursing home, 8 other women had the rash.
And that's how she found out she was getting cheated on.
Not cheated.
Oh.
One guy in there has 8 girlfriends. They all know about each other. They share each night with him. So I learned early on.
Poly.
1, people love to have sex. It doesn't matter what age.
Yeah.
And it's important to them. 2, nothing should surprise you. You have to literally look for everything. It doesn't matter. And 3, yes, I guess if you're in LA, there may be No, I did learn that as you get older, I think people do have like open relationships or poly. Because my grandpa, actually, I don't think Jose even knows this. My dad, on my dad's side, is still alive. He's almost 100, actually. Oh. He has 3 girlfriends. And when my grandma originally died, he went on J-date and found 2 girls, and he went on dates with them. Both never wanted to get married again. So they were like, whatever. I can see you Monday and Tuesday, but then I'll see you maybe end of the week. And the other one was like, I'll see you Wednesday, Thursday, and then maybe, next week. And so he told both of them, well, can I see you on Monday, Tuesday, and you on Thursday, Friday?
Oh, so
and they were like, sure. And then the one was like, I just need to have you a couple weeks a year to go on a cruise. Because that was her thing. She had to go on these cruises. So apparently he has a couple girlfriends.
I love that.
And they know about each other.
I mean, I love that because they all know about each other.
But they all had been married.
Yeah, of course.
And it was like, but this is like, I can't believe it, at 90-something.
Well, that was my grandma. She got a boyfriend she got remarried, I think, at 86.
Wow.
And yeah.
Wow. So that's what I mean, is the whole point is, I do think that sex matters to people. Yeah. Which is why, so if you need me on your podcast anytime about sex.
Yes.
So, all right, one last thing.
The dick doctor. The dick whisperer.
I know. Oh my God, the dick whisperer. I know, but that's bad. That's melanoma. No. That's about, I know. Those are bad cancers. What about that separately? Oh my God. Okay, I've learned
so much today. It is crazy.
I want to think. What do you want? Is there anything about, because we literally talked about me the whole time. Is there anything about you?
Way, that's actually what I want.
No, it's great. I want to do another one, but I do want to do, if we wanted to do, let's do one segment.
The thing is you know so much, and I know you know so much, but it's just like,
I just constantly learning. I always want to learn. And that's why I think for me, in terms of,
I only want to ever see doctors like that.
And that's why I think that so I've had a lot of scenarios. Oh, this is what I wanted to tell my friend last night at dinner. I'll tell you this story, because this has been really kind of haunting me a little bit. So I have never really had issues with patients till the past couple years. And what I mean by that is, I feel like as TikTok, social media has become a lot more popular, people's expectations of customer service, and their expectations of perfection have become way worse.
Well, yeah,
you know?
filters have like really
Yeah, and like,
ruined
and I
some
also
things,
am very realistic with people. Like, I've even had people yell at me when I say you need a facelift. Like, and I think to me that's me being honest. Like, if somebody, I just was talking to a guy yesterday from Arizona. Him and his mom were doing a consult with me for his mom, but she couldn't speak English. She's from Middle East, and so they were like, she has acne scars and she's very depressed by them and everything, and melasma, but her face is like literally hanging like this. And I said to him, I said, unfortunately, you know, the lasers are not going to work on her. She actually, if you go like this, what happens to her scars? And he's like, they're almost all gone. I said, yeah, she just needs this with fat grafting. We need to take fat, give her volume, and lift. And if it's lifted, it's be like 50-60% better. And he was like, well, she doesn't want that. I was like, I know she doesn't. She might not want it, but that's what she
the
needs.
solution.
Right.
Yeah.
And so that's the thing is you always have to drill down to what is actually needed versus what someone tells you. So now what I've realized is when digital became very popular and people could comment, could write a review, if they didn't get what they wanted, they would do that.
Yes.
Even if someone told you what was right. And that's very hard for me. And that was really hard. So even to the point where I'll do a paid consult, $500, right? Because I said that's what I charge, but it goes towards treatment. And
By the way, that's
I think very fair
that's
because
like,
my
that's how it
time, I have a
is
lot of
in Los
clients. So I have to do something that I know the value is what someone's going to spend money on, you know, like I'm not gonna do $100 because it's not worth, my treatments are much more. So I'd rather it be people I know who are going to do treatment with me and value my expertise because the opinions I give are well more advanced. You could tell from the conversations that we're having. And so, and then people always say to me, well, that doctor never told me that. Or why am I getting all these other opinions? Because I had a young girl that came to me the other day. She was botched from lipo. And I told her what she needed, which is a much more complicated case. And I even gave her something no one does, what we do, where instead of doing a tummy tuck to actually fix it, which is what she needs, doing a reverse where we actually lift it from the top and do a little mini thing at the bottom. It's a reconstructive surgery that we created. And I was like, so I'm giving you 1, 2, 3 options.
Yeah.
The easiest, which is not the best, it may improve, may not.
Right.
The middle, which is going to be a much bigger scar, is the treatment gold standard.
Yeah.
Go to anyone else, you won't be contoured, it'll be flat and tight. With me, it'll be actually shaped. 3, we hide the scars, no one will ever see it, and it'll be shaped, much more complex.
Right.
Double the price, way more difficult, right?
But your option.
But she was very thankful. But she said to me, why aren't the other doctors telling me that? And I said, because they're not good enough. They're not advanced enough.
Yeah.
They can't do that. It's not even their fault.
Yeah.
They just don't know how. I always pushed it and developed it over time. And that's why you came to me. You know, and she's like, I'm going to book with you. You know, she basically said that. So I have patients though, where when I do that, they'll go, well, that's way overpriced or something like that. I said, but how is it overpriced when no one does it? There is no price. It's so many things together. It's not, I don't even try and make it expensive. If I had a non-for-profit that could pay for people to have this, I would still do it.
Totally.
It's the treatment they need. And so that's the thing is I'll get people very frustrated. I have a girl like the other day where we $500 consult, had a great call with her. In fact, it was acne scars on an African American and difficult to treat because dark skin, you can't do strong lasers. So I went through that with her. And she goes, but you show videos where you do it. I said, but for your skin, it's too dark. We'll never be able to do that. The options are this, but it's going to take many treatments. It will improve, but over time. And you have these spots on your face that have nothing to do with acne scars, but guess what? I'm going to do it for you for free when you do it because I don't know a lot of people that know how to fix them.
Right.
And they're these little growths that she had. She writes me a terrible review. She writes me this long review saying they pushed skincare on me. He tells me I can't do the treatment I want, so they're offering me this other thing that's more expensive. I'm like, it's not more expensive. It's more treatments.
Yeah.
It's not my fault. It's her skin. So I responded to it. She didn't write back. We actually even called her and I was going to give her the money back to just take the review down because I was so
interesting is that online, like, and I see this because I would say that I am a prosumer. Like, I'm a step up above a consumer. Just because, like, I get a product, I look at it, I look at the ingredients, I Google the ingredients, I try to see how the ingredients work. I'm like, oh, red light's great. Which one's the best one?
So you're not going to listen to an influencer that told you.
One, fuck no. I am the influencer.
I know, but that's the thing that's crazy is like, people will just be like, oh, this is the best product. And then they're like using it and they have no idea what's even in it. What it's doing at all.
I will listen to dermatologists say two different things.
I know, that's the thing.
So it is
you can't always believe.
West. And like another theme of this conversation is you're the advocate of your own body. You have to do your own research.
I agree.
You have to find the people that speak to you and do the things that, you believe in, or go to the doctors that you believe in.
Yeah,
because
I think that's why
no one's
having
gonna help you.
The social presence that I had, and you even following me back before I even did social media from Real Self, because I was putting out opinions there and
all the time.
And even questioning answers of what other doctors were there, because you could see them and I'd be like, no, that's not true when you do this or this. And you just have to find someone that you actually trust that gives off that knowledge. And that's the thing is I was telling a lot of people, like, I think in this day and age, because things can be photoshopped, but what can't be are live videos of people the day after or immediately after. And the criticism I always get, actually, in fact, we had to change my Instagram settings for the first time in my career to be only followers that can comment and blocking a bunch of words like that people might say, like botched or hacked or whatever, because we'll post something where it's swollen, it's inflamed, or like maybe the scar is a little bit higher than a normal tummy tuck, but this girl, the skin couldn't, you don't know, and you can't understand, and they'll be like, someone wrote, go back to go learn in Colombia. I go, what you don't even understand is I taught it there. I used to teach there. Like, I actually wrote the books with it. I'm like, this is so crazy.
Surgeon somewhere, like I think in the Ukraine, and their work just keeps popping up on my Explore page. And I think it's because of I'm constantly interested in the comments, because people are like, I saw this on, how come this image is on another doctor's page? And she's like, because he stole it from me.
Yeah,
that's why.
And I've had that happen.
I have the video. Look at the Instagram. Oh,
I've sued Instagrams. I've gotten people shut down.
It's crazy.
So that's the thing I was saying is,
everybody, critical thought here. Critical thought. If you're gonna get surgery on your face, if you're gonna inject yourself, if you're gonna do some of these things, like, for the love of God, spend 5 minutes to make sure that the person you're getting advice from is somebody that you should listen to.
Yeah.
It's nuts.
And the other thing too is I just think nowadays, with digital, it can be faked. And so you have to be very careful to really listen to the person, to know that they're credentialed, that they,
don't buy NAD off of TikTok shop.
I agree.
I can't believe that has to be said.
Yeah, I know. And also just with reviews, I think you would be very critical, because people nowadays, I said, they're just willing to say whatever just to get the money back. Or like if you do a consult and they're unhappy, instead of that $500 being to get expert opinion, if it wasn't the opinion they wanted, they'll try and threaten you. Like I had a girl write me this whole long thing about gonna report me to the medical board if I didn't give her $500 back because it wasn't what she believed in. I was like,
that's gonna be a longer process than you think.
I couldn't believe it. I was like, wow, someone had that much time to actually do that. And the funny thing was we had a great conversation. I was talking about our dogs. I was talking about how it's going to be so great treating you and this and that. And then when the quotes come in, maybe more expensive than they wanted to do, rather than saying, you know what, I wish I could afford that. I can't. Is there anything else I can do?
Yeah.
Like normal communication, normal like relationship.
But again, this goes back to people's insecurities where we've hit on 3 things: looks, sex, and money.
That's what this is about. That's the sad thing. It's all about,
money, which is very, very LA, but I think like it doesn't surprise me that you have outsized reactions because you deal in like 3 very sensitive topics for people.
Yeah, that's true.
So it makes
sense.
And
it goes down, it goes deep into their self-confidence and into their emotions.
Yeah.
Yeah. And I try my best, but I can't be, I know, and I can't be like a therapist. I mean, I try to. I mean, very close to my clients, but like I'm not a therapist myself.
Right.
So I'm more direct, be like, I want to help you. I'd love to, because especially for me, it's artistry and skill to be able to do something like a phenol peel that's very dangerous. And then all of a sudden, one treatment, it's 60-70% better. And this person's life has changed. It makes me so excited.
Totally. To clear their acne,
all those things, everything. I mean, even confidence. It just depends. Like I have some clients who are on major TV shows and that little thing just gives them that extra bit of confidence or, like just whatever it is that's going to make them feel better.
100%. Yes.
So let's talk about crimes of the heart. I want to know.
Of the heart.
Because I literally, is it does it have like real crime? Or this is like,
it did, but I
and
mean,
then it branched out.
Not real crime. It's
like I was gonna say, is this
love
like people
crimes.
killing people for
No,
real?
this is like people cheating
Okay, that's
and
what I
like
thought.
love
So
crimes.
I'm a little crazy. I watch all the Instagrams
Yeah.
where people cheat and get
yeah.
caught, or predators. I'm very big into these. I don't know why. They're just like, it's like pimple popper.
Yeah, it's
you watch
primal.
one and then you're like, oh my God.
Yeah.
And you go, who is that like, why do they all look like this?
Yeah, I mean,
It's so crazy.
yes, yeah. Stop.
And right now I've been watching the ones where it's like in Glendale and Long Beach. I'm getting scared.
Ooh.
It's scary. Like what's going on? So wait, tell me about how you started this.
I started this. I started this because I have comically tragic stories
Oh
when
my
it comes
gosh.
to
Well, we'll go into like a lot of
like,
stories later. I want to do it
romance
again.
and dating.
Okay. I feel like a lot of people have that. So
Yes.
that could literally lead into daily podcasts if you want.
Yeah, exactly. And that's really how it started. And I feel like in the same way that people are honest with you, a lot of people come to talk to me about their dating stories or like issues around sex because I'm not uncomfortable talking about it. And
I like that.
I'm
How did they know that?
probably because I am curious, so I'm interested in talking to them about their love lives or their sex lives, and I can like sense when somebody is like holding back or feeling uncomfortable, and then just creating an environment where they know they're not being judged.
That's great.
Or like leading with example. I think if you let people know like, oh, I have this insecurity, or oh yeah, you know, like I thought I was very performative with sex for a very long time until I realized like how to like take control of my own pleasure. And then people are like, really? How did you?
And then they open.
How did you do? Like, how did you do that? And I'm like,
they open up.
then they open up. You know, it's by being like a little bit vulnerable or sharing yourself, you can get people to open up and share with you.
Well, I have a lot of trans clients.
Oh, so there
And
you
a
go.
lot of my trans clients are very nervous about going to see a doctor for the first time.
Yeah.
And so I do a lot of virtual consults. And so a lot of my clients, and this is a good example of sex and everything, one of my clients was trans male to female and wanted then to have the penis, the little there's a little section like that's there to be a little bit bigger. So it's not an actual. It's put it this way: it's more like the clitoris, just to be for it to be a little bit enlarged, more ambiguous.
Okay. Yeah.
So male to female, but now having like a clitoris wanted to be a little bit bigger. So I think them asking anyone about that would have been really difficult. So the initial conversation, the first minute or two, when they were about getting out why they wanted and what they wanted. And I was like, I can do that. This is great. I've done it a few times. They're like, what? And I was like, yeah, I have tons of patients that come to me. Like one of my first patients that was male to female, but still had a penis. I walk into the room and I see this very attractive kind of farm boy in the corner. And I see this beautiful Asian girl in a skirt to the right. And the one sitting down, the one standing. So I figured the one sitting down was my patient. And it said penis enlargement. So I go in and I go, oh, you're here for treatment? And he goes, no, you're here for her. And it was actually her treatment because she still had a penis. And so now she's been my client forever and her penis is a lot bigger. But it was just funny how I made an assumption when I went in, but I was so open that they were like so excited to talk about it and do it. And that patient every time I go in is like, I love coming here because you're so nice. I'm so comfortable. And they're telling me about every other doctor visit that they go to and how they don't feel they can actually be themselves and say the things that they want to say.
To be also willing to, at least like specifically like with the trans conversation, you have to be okay fucking up. Like you can't, and people are people. Like at the end of the day, a person is a person before they're a trans individual. Not that I should be the spokesperson for like.
But I'm just saying, like,
community,
for opening up to you about insecurities and things that they want when it comes to like sex and things that are like what people consider dirty or not something they talk about.
Right.
I feel like that's great that you're able to do that. So it led into them. They felt really open with you. And then what were the conversations that you started to highlight on the podcast?
I got really excited about speaking to everyday people and then also experts and learning like the through lines, and that most people really want to be seen. I think that there's been a lot of confusion like in relationships and love and also sex because they all go hand in hand, and these are things that we are expected to do well. but we are not taught them, in the same way that like you are expected to love yourself, but nobody's ever really taught people how to establish a boundary, build self-trust, build self-confidence, and all of those things affect the quality of your life, right?
Yeah.
So I started to realize like, oh, a lot of this is really intertwined, and my personal journey with love and dating was a mixture of like curiosity and just like wanting to date everyone and have experiences, and then that led to like some pretty painful things that then I had self-worth issues. So like my personal like inner demons or baggage like took the form of self-worth.
Yeah.
And so that was my journey, and I feel like listeners probably are going through something very similar. Like it all boils down to a few things. Like we either think we're too much or not enough, and it impacts the way that we show up in our relationships. And then there's skills. There's like communication skills, and like, you know, with
That's
you and your
one of the biggest, I think.
with you and your fiance, like I'm sure at this point you guys know how to fight.
Yeah, we don't fight a lot. Very rarely.
Sure.
Very. But we talk because we talk about everything.
So,
And I've always been
right.
like that. Like even last night, I could tell we were at dinner and it was doing the first time. So when we first met, I told him I didn't know if I could be in a serious relationship because I'm very fluid with sex. Like I could literally have a million people that I'd want to have sex with, but still love one person. And I always have been like that.
Yeah.
But when I met him, he's like, I'm not into that. You have to be loyal and serious. So I was like, is it worth it to do that?
Yeah.
Or choose what I would maybe want to do if I was free, you know, be able to. And I chose, well, I want to be with this person. So then, if I ever would say someone's attractive or don't you think that guy's good looking or something, he would get like very uptight or whatever. So then I just said to him, I said, yesterday he said something about how this one guy was so attractive and this and that. And I go, what? I go, you're talking about another guy? And he like kind of like blushed a little bit. And I was like, oh, so now you may want to switch it around a little bit. And he was like, no, not at all. But I could tell that sometimes like people get nervous about saying the truth or whatever. But I'm sure girls that are with a guy still find other guys attractive.
Everybody finds everybody.
Yeah, that's what I
attractive.
mean.
Like,
so
you
I was
don't
like,
die.
I'd rather him just tell me because I maybe be like, well, if you want to go do it, okay. You know, like
right.
sometimes people are like that. Like there are people.
A conversation. I also think there's something to be said for safety.
Oh,
like
yeah.
Feeling safe and secure in something allows you to be free in different ways.
100%.
You know, I think most people want peace. Nobody wakes up thinking today seems like a good day to lose
like
my
I'm
mind
gonna cause
over a man.
I'm gonna cause an issue. Yeah.
No, like that's not how most people are walking through the world. So it is interesting how we all really do want like the same things.
Oh, yeah.
And I find that a lot of us are bleeding out on people who didn't hurt us. And it's kind of about realizing like, how are you hurt? How are you hurting other people? Can you stop that? And can we all like, somebody once came on the show and I asked everybody, what's the best love or dating advice you've ever received? And she said, leave people better than you found them.
Oh, that's nice.
And I have tried to adopt that as a motto. And I think that that's really special because if we all did that, I think that just the world would be better.
Yeah, because it's rare for that to occur.
Yeah, it's
because
rare
a
for that
lot
to
of
occur.
people will either leave and try and hurt the other person, say bad things about
Your
them.
dick is too small.
Oh yeah, I've had
You
people
know?
say that to me, and
No,
it's
no,
not.
no. That was a callback to the patient.
Oh
with
no,
the
I
guy.
know. I know. I've literally had people put that on Instagram about me, even though it's not true. They just wanted to make people think that that was
that's
true.
illegal.
I mean, a lot of things are illegal.
Oh, that's true.
That's the thing. But people just some people just, if they're hurt, they want to hurt other people.
100% lash out. Yes.
You know, and that's the worst because I think that you should. Either you were brought up wrong or it's just you want to cause more problems in the end. But it's better, even if you're hurt, to just separate yourself and move on, I think, or try and make amends and realize, you know what, it's not working out. Even if someone hurt you, even if they were the worst person in the world, you'd be like, thank you for everything you taught me.
Yeah.
You might have taught me that you were terrible. And that's what I don't deserve and never need to see again.
Yeah.
And then leave versus being like, I'm going to try and have retribution. Like, I'll give you an example. I have a lawsuit with someone who did something financially bad to me for years. And now he declared bankruptcy, so he's trying to get away with it. But long story short is I found 9 other people that he also did it to.
Yeah.
And the federal government now is going to be going against him. So the government came to me and said, we need the names of all those people. So I emailed one of them. And that person writes me back the meanest email ever, being like, so it was saying negative things to me about our previous relationship because we were friends, but then she was friends with him. So I stopped talking to her. So she wrote all these mean things to me. And I was like, years has gone by. It's like 7 years. I'm like, you still are thinking about
This?
7 years ago when I was your friend and one little thing happened? I was like, that. I feel bad actually because I haven't even thought of her for 7 years.
Right.
Never once. But yet I only had to now because I know this happened.
Well, there's like,
right?
I used to be a little bit like that. Like, I think part of growing up is, I wanted people to hurt the way that they had hurt me, but
That's a lot of people though.
It's a lot of people, but you have to realize that anger and like that is like holding a hot coal and expecting you to get burned. It's just gonna
burn you.
Like that lives inside of you.
I know.
Because every day that I wake up and I think, oh, fuck Jason. Like
right, that's just taken away from your own life.
I'm thinking that. That's a thought.
And that's what I'm
energy
saying.
That's living in my
And
body.
the sad part was when I emailed her, I was actually thinking of hearing back from her and hoping she was successful, even though she actually did bad stuff to me.
Right.
So, and I've moved on from that, even though it's like, so it's crazy. I didn't write back though. I didn't write back because I'm like, I've already, everything to me is is not about looking back, it's about moving forward.
Yeah.
And if you're constantly going to, what is the word? Want to have like a retribution.
Like relitigate the past.
It's just it's gonna ruin your own life.
Yeah.
Like you just got to move on. Like I don't think about anyone that's done anything bad to me. I just figure out what can I do that's 10 times better for me now.
Yeah, and
use that as a learning experience.
That's a mindset, and like
I know.
Maybe you were born with that. Maybe you learned that because of the circumstances of your job, and just I do feel like sometimes that plays into it, right? That like you've developed like a mental acuity and like a routine that will probably serve you outside of just work. Well, a lot of people don't have that.
Yeah, I mean, I wish I never had to sue someone or do anything like that. But sometimes people do some such bad things that there's no other way to protect yourself. Like,
But you don't get that in love and dating.
It's true.
So like if we date for 6 years and I cheat on you and I waste your time, I waste the best years of your life, there's no recourse.
You're right.
You can't sue me.
You're right.
And I think like that's what's so interesting is
that's why I think it gets so emotional for people.
It's so emotional for people, and they do need like an outlet.
I'm hurt. How could they have done that to me?
Yeah.
And wasted all my time or whatever.
Wasted all my time. I wish there was something I could do.
Yeah.
Also, like, I think it's really hard to feel like somebody sees you and then doesn't value you.
Yeah. Because with me, I'm confident enough that if somebody were to cheat or do something bad to me, and I would just move on from them, and it would be their loss.
Well, a diamond does not need to tell the other gems it's a diamond. It knows it's a diamond, right?
That's
you
cute.
do not need to educate. Like if you know what you were worth, you do not need to let other people know what you're worth. You just move forward.
It's true.
Like somebody's going to look at that and go, "Holy fuck, that's a diamond."
So then you got to, in this podcast, you got to educate all the people that have been that have had problems that they're diamonds.
Right.
I like that.
Basically, yeah. I mean, I guess that is sort of what I'm trying to do.
That's good.
Make people feel less alone and remind them that like every lock has a key.
All right.
Generally, there's
that's good.
one.
Then we're going to talk more about that in the future.
Yeah, when you come
I can't
on the show.
wait. Yeah, tell everybody your Instagram, or do you have any website for the podcast? Or is it just on YouTube?
The podcast is Crimes of the Heart. It's like available
Is it on YouTube?
Anywhere podcasts are streamed, not on YouTube.
Oh, okay.
But you can find it on Spotify, Apple, all the things. Basically anywhere except for YouTube.
Spotify, YouTube.
And
Or
then,
Spotify, Apple, Spotify, Apple.
Yeah, I'm at I Could Be Blonder. Because I could be blonder.
That's cute.
Thanks.
Wait, but you could just bleach it more, no?
Yeah, I could be
It's already
blonder.
bleached. It's pretty blonde.
It's pretty
I like
blonde.
it. I like
It's pretty
it.
blonde, but I could be blonder. So that's
cute.
the Instagram. Yeah.
Well, what's blonder mean? Literal, or is it the things that people know about blondes?
Both. I came up with it when I was
That's cute.
12. So
Oh.
it's been in the fam for a minute.
Okay.
Yeah. And
I like it.
I never changed it.
Yeah, because it's funny. To me, when I looked at yours, I was like, oh, blondes normally are like like when I watched Legally Blonde, they like underestimated her, think they're not smart, it's all partying, you
Yeah.
know, Southern California, I don't know, whatever
yeah, totally.
type of thing, or Tampa, Florida, like that type. I don't know how to describe it, but with you, you're very educated.
Yeah.
You're really smart. So I feel like it should be.
I could
I'm
be dumber.
blonde. I know. I'm like something about like I'm blonde, but you're gonna it's gonna shock you or something. I don't know how to describe it. It's like Legally Blonde. That's how I see you. Like all of a sudden she was the best lawyer in the world, you know?
I think it might be late for me to be a lawyer.
Well, you don't need to be, but it sounds like therapist to me. I don't know. The blonde, the best blonde
enthusiast.
therapist.
Yeah.
Oh, that too. I definitely think you could be a spokesperson for Peptides.
I am working on it.
I love it. You could help a lot of women with chronic fatigue, Lyme, any of these autoimmune things.
Yeah,
That could
get
be really
healthy
good.
and then get hot.
Health. Oh my God, that would be a good podcast. Healthy and hot. All right,
never
we're
know.
gonna start it. Maybe that's us too, together.
Get
All right, what do you
healthy
guys
and
think?
hot.
All right, this is great. Thank you for coming on.
Having me.